Welcome back. Today we're diving into something really relevant for, well, a huge number of women. The whole journey of reproductive health, from monthly cycles, which can range from just annoying to seriously painful, right through to menopause and all those changes.
It's definitely a shared experience and sometimes a really disruptive one. When you look at the stats, it's kind of staggering.
Yeah.
Well, dysmenorrhea, that's the term for painful periods. It affects anywhere from like 17% up to maybe 90% of menstruating women.
90%. Wow.
Yeah, it's a huge range. And for maybe 15% of them, it's actually bad enough to mess up their daily life pretty regularly.
That's significant.
And then you've got endometriosis, too, affecting another 6 to 10% or so. These aren't small things.
Absolutely not. And then, comes menopause, another massive transition.
Definitely. And the numbers there are huge, too. By 2025, next year, over 1 billion women globally will be in menopause.
1 billion. And while it's natural, the symptoms can be really tough. Like hot flashes, up to 80% of women get those in perimenopause.
That's right. And they really impact sleep, mood, work.
Yeah, and it's not just hot flashes, is it? There can be other things like heart health concerns, memory changes, even skin and hair issues.
Exactly. And, while hormone therapy exists, there are potential risks, which leads a lot of women to look for other options.
Non-hormonal, more natural approaches.
Precisely. Which brings us neatly to what we're looking at today.
Okay, let's get into it. We've been digging into the research on Pycnogenol, that's Pycnogenol, French maritime pine bark extract.
Right. And it's key to understand, like you said, it's not a hormone. It's a natural antioxidant and anti-inflammatory.
So fighting damage and calming inflammation.
Basically, yes. And what's really striking is the amount of research specifically on women's health. We found 27 clinical studies.
27?
Yeah, involving over 2,200 women, all ages, looking at its effects.
Okay, that's pretty extensive. So what kind of areas did these studies cover?
Well, quite a range, actually. Menstrual pain and endometriosis, a lot on menopausal symptoms, and even some surprising findings on hair and skin health.
And crucially, the research suggests these benefits happen without messing with hormone levels.
That seems to be a consistent finding, yes, which is a big plus for many women.
Okay, so our mission for this deep dive is to really unpack what that science says. Can Pycnogenol actually offer some relief and support here?
Let's see what the studies show, starting with menstrual issues, dysmenorrhea and endometriosis.
Sounds good. That seems like a major area of interest.
It does. So there was an early pilot trial that suggested improvements, less abdominal discomfort, fewer cramps, less tenderness.
Okay.
In women who already had endometriosis or severe cramps or just chronic pelvic discomfort, kind of an initial hint.
Right, a starting point. Did follow-up studies confirm that?
They did. One study had women with dysmenorrhea take Pycnogenol for 2 cycles. They saw a 41% drop in their discomfort scores.
41%, that's quite a bit.
Yeah, and fewer days feeling lousy, less backache. But the really interesting bit, a 60% reduction in using painkillers.
60%. So it might be doing more than just masking the pain.
That's what it suggests, yeah. Potentially addressing the underlying issues. And then a more rigorous study, double-blind, placebo-controlled.
Gold standard.
Pretty much. It confirmed the drop in discomfort and, again, significantly less pain medication used compared to before and compared to the placebo group.
Okay.
And interestingly, that benefit seemed to hang around even after they stopped taking it for a bit.
Wow, that persistence is really encouraging.
Yeah.
And does it work alongside other treatments? Like, I think I saw something about combining it with birth control pills.
Yes, exactly. Low-dose oral contraceptives.
Yeah.
One study looked at that for severe cramps.
Yeah.
Really impressive results. A 78% improvement in cramps for the group, taking both Pycnogenol and the contraceptive.
78. Compared to just the pill.
Compared to only 25% improvement with just the pill alone.
Big difference.
Huge. And get this, 27% of the women in the combo group became completely discomfort-free.
Wow. 0 in the pill-only group.
0. So it really seemed to boost the effect.
That could be life-changing for some women. And you mentioned endometriosis specifically, too.
Yeah, separate research there. One study compared it to leuprorelin, which is a common drug used after endometriosis surgery. It works by lowering estrogen.
Right, I've heard of that.
So both initially helped reduce symptoms, but after stopping the treatment, the leuprorelin group saw symptoms come back quite significantly, whereas the Pycnogenol group maintained lower symptom levels without it affecting their estrogen.
Okay, so potentially a more sustained effect without the hormonal impact.
Seems like it. A more sustained approach, maybe.
Did they also try combining Pycnogenol with contraceptives for endometriosis pain?
They did. And again, it showed an additive benefit, even greater reduction in discomfort.
Really?
Yeah, and 56% of women in that combined group reported complete resolution of cramps, compared to 0% in the contraceptive-only group.
56% becoming cramp-free. That's remarkable.
It really suggests a synergistic effect is happening there.
Is there any idea how it's working, like on a deeper level? You mentioned something about NFG.
Yeah, there's some research exploring the mechanism. It suggests Pycnogenol helps the contraceptives to block or dampen the NFP cascade.
Okay, remind me what that is.
It's basically a key pathway in the body that triggers inflammation. So Pycnogenol seems to help put the brakes on that inflammatory process, especially in endometriosis.
Which makes sense, given inflammation is a big part of period pain in endo.
Exactly. Those potent anti-inflammatory properties seem really central here.
Okay, so a compelling picture emerging for menstrual health. What about menopause? That's another area where women are often looking for non-hormonal help.
Absolutely. And the research base for Pycnogenol and menopause is also pretty solid. Nearly 600 women studied across different trials.
600. Okay. What did they find?
Well, one key study was a 6-month randomized, double-blind, placebo-controlled trial. Really robust design. It looked at perimenopausal women and used the Women's Health Questionnaire, which covers a lot of ground.
What kind of symptoms improved?
Pretty much across the board. Significant improvements in somatic symptoms, those vasomotor ones like hot flashes and sweating.
It's a classic.
Yeah, but also mood, memory, attractiveness scores, anxiety, sexual behavior, sleep problems, even menstrual issues if they were still having them.
That's really comprehensive, not just hot flashes.
No, a much broader effect. And again, the studies consistently show this happens without altering hormone levels. That's a major point.
Definitely. Did that study show anything else, like other health markers?
It did, actually. It showed Pycnogenol helped normalize slightly high blood pressure, and it improved cholesterol profiles.
How so?
Lowered the LDL, the bad cholesterol, and increased HDL, the good kind. So potential cardiovascular benefits, too, during that transition.
That's a significant bonus. Were there other menopause studies reinforcing this?
Yes, quite a few. Another one tracked 33 common symptoms in women in the menopausal transition. Found significant improvements after just 8 weeks.
8 weeks? That's pretty quick.
Seems so. And even a low dose, 60 milligrams a day, showed benefits. A study found a 17% drop in the total menopause symptom score compared to placebo after 3 months.
Even at a low dose?
Yep. Plus better energy levels, less fatigue, better sleep, and less joint or muscle soreness. And repeating the theme, no hormonal changes.
Consistent message there. Did any studies compare directly to other natural menopause options?
There was a recent one, yes. Compared Pycnogenol to 2 other plant extracts often used for menopause.
And the verdict?
The results suggested Pycnogenol was more effective, particularly for improving psychological symptoms, vasomotor issues like hot flashes, and sexual symptoms in postmenopausal women.
Okay, so it held its own in comparison.
Yeah.
Now, moving on, you mentioned something I found really unexpected: hair health.
Yes, this is newer research, but really fascinating, especially for menopausal women who often experience hair thinning.
Tell me about that study.
It was double-blind, randomized, placebo-controlled again, 76 healthy menopausal women.
Okay.
After just 2 months of taking Pycnogenol, they saw a significant 30% increase in hair density compared to when they started.
30%? That's a noticeable difference.
Absolutely. And it was a 15% increase compared to the placebo group. Plus, the improved density seemed to stick around with longer use.
That's fantastic. Why? How does it help hair density?
Well, the study found it improved the skin integrity on the scalp. Less water loss, so better moisture balance.
A healthier scalp environment.
Exactly. And they also confirmed it boosts microcirculation in the skin.
Ah, so better blood flow.
Right. Which means better delivery of nutrients and oxygen to the hair follicles themselves, supporting healthier growth.
Makes sense. Better scalp health, better nutrient supply. Okay, so we've covered periods, menopause, hair. Were there other areas Pycnogenol was studied for in women?
Yeah, the research is surprisingly broad. For instance, urinary tract infections, UTIs. Yeah, one study showed women taking Pycnogenol had fewer UTIs compared to a control group, and even compared to a group taking cranberry extract.
Interesting. Why would that be?
Likely linked back to those anti-inflammatory and antioxidant effects again. Then there's a whole load of research on skin health.
Oh, right. You mentioned skin earlier.
Over 20 dermatological studies showing benefits like increased hydration, better elasticity, improved microcirculation,
Fewer wrinkles.
reduced wrinkles, yeah, and less pigmentation like melasma or age spots.
Can you give an example?
Sure. One study found it improved the skin barrier and elasticity in women who worked outdoors a lot. Another, in menopausal women, showed it boosted hyaluronic acid production in the skin.
Ah, the stuff that helps keep skin hydrated and plump.
Exactly. Better hydration, better elasticity. They also saw improved blood flow in tiny skin capillaries and even some increased resistance to UV-induced redness.
Wow, quite a range of skin benefits.
Huh?
Anything else?
Briefly, yeah. Studies have touched on things like chronic venous insufficiency, vein problems in the legs, circulation issues like Raynaud's, even back discomfort during pregnancy, and things like postpartum hemorrhoids or varicose veins.
It really does seem quite versatile. And to reiterate, the overall picture from all this research is that it's considered safe.
Yes, based on the evidence from these numerous studies, it appears to be a safe natural compound.
And crucially, hormone-free.
That's the consistent message, yes. Safe, natural, and hormone-free support.
Okay, so let's try and wrap this up. The key takeaway seems to be that Pycnogenol, this pine bark extract, shows potential across a really wide spectrum of women's health issues.
From easing period pain and endometriosis symptoms to helping manage a whole host of menopausal complaints.
Including those surprising benefits for hair density.
And improving various aspects of skin health and potentially even helping with things like UTIs and circulation.
And all this seems to be backed by a fair amount of clinical research, specifically in women.
That's right, a growing body of evidence.
And the fact that these studies consistently show these effects without impacting hormone levels is, I think, really significant for women looking for those kinds of natural options.
It really is a key differentiator and a major point of interest.
Definitely gives you something to think about. So for you listening, considering all this research we've discussed, what aspect of Pycnogenol's potential really stands out to you? What questions might you have about possibly exploring a natural compound like this for your own well-being routine? Something to ponder.